the primary bias, this is going to be your dantian. So this is like bladder 32, Ren 4. Yeah, it's your lower dantian, excuse me, lower. It's your lower dantian. That's where your center of gravity is. So everything in your body moves from there. Some of the most primal movements that I want my patients doing, and I want you to try, is one of the biggest things you can do for spinal health is squats. So when you're squatting, you want to be able to bring your whole body down and your whole body up. So give it a try. And if you want to further complicate it, you can put your feet together and do whole body down. Keep your knees together, feet together. But when you're doing your squats, one of the easiest things you can do to prevent knee issues is make sure you go below 90 degrees. Notice how I put my hands up in the air. This is so I don't do a squat like this. Okay, you want to do a squat. So if I had my name right here, or let's say I was like, number 52, and put it there, then you just, you want to make sure you can read that. So you go down and up. Drive your knees out. So that's a way you can fix the primary bias. That's a primal movement. You'll be shocked at how few of your patients can actually do squats. So do some air squats. I did 100 this morning. I was in a hotel and there's some dumbbells, but I just did 100 squats while I read. It was pretty nice. Okay, so you look at the iliac crest. So I'm going to try to draw for you. Okay, so this is the PSIS. This is a man's. It's going to be a little more narrow. This is the sacrum, and here's the coccyx. Okay. Oop. So if you were to draw a line across here, so I'm just going to draw a line. I know it's going to be hard for you to see, but we'll see if you can let me know which one of these is higher than the other one. Okay, so from the camera, how's the visual? Can you actually get a sense of the line there? So you see on this person, this is their back, so their left side, this is left, this is right. So one of the things that will happen first in a person is their primary bias will go out. So they will end up, this person will lean more to the left than the right side, and so this sacrum will drive up. I think I made this a little too high. It's going to be more like that. That looks closer. Yeah, here is the lumbar sacral joint. Okay, so what you want to do ultimately is you have to diagnose first the primary bias. So when you look at the primary bias, there's two options. There's three. Either they're balanced, that's one option, or they have the left side as their primary bias or their right side. So if the left side's the primary bias, it will be pulled up, it'll be contracted, it'll be higher than the right side. Why is this important? Because this is going to affect your needling. So learn the diagnosis first. So we're doing a spinal exam on our patient, and what we found is their left side is higher than their right. Now there's also things you can look at if they're lying down. You can check their legs. You can see if there's one leg that sticks out farther than the other, when they're lying on the table, if this is their feet. It's very rare that someone actually has a length discrepancy in their femur. So they may have gone to their chiropractor or physical therapist, and they said, oh, you've got a short leg, one leg shorter than the other. Now, that can be confirmed, but it needs to be actually measured with either an x-ray or someone who is really good at landmarks, the bony landmarks. But most cases, the imbalance is coming from the hip. So one hip is pulled higher than the other. So what are conditions that can show up with a left-sided imbalance. So first thing, let's talk about stools and digestion. I know we'll be there in a minute, but if you're more contracted on the left side than the right, you're going to have more loose stools, more diarrhea, unformed digestion. Right side, you'll have more, or excuse me, it's the opposite. Forget, okay, left bias is going to be more constipation. Right will be loose stools. The other thing that they can have is they can have sciatica on one side or the other. Most of the time when the hips are contracted up, you'll have sciatica on either side. So that can be an issue. Even I've seen my teacher diagnose the sex of a baby for pregnant women. And so if a woman tends to have more issues on the right side, she's more right is her primary bias, then she may be more likely to have a boy. It's the more young side of the body. Or left is going to be more of a girl. Okay, so there's just some little tricks that you can learn to help figure out the biases. So one thing I like to do is I'll have my patients, I'll have them stand up, and you want to look at their structure. So Sam, do you mind if I use you real quick? Do you mind coming up here real quick? It'll just take 30 seconds. Or Donna can, okay. Great. So, so just stand this way. So you want to look at your patient's iliac crest. So the way that you go about this is you're going to palpate along the top of the iliac crest. You're going to find those bony landmarks. So you find the PSIS. So in her case, hers are right here and here. And you want to see, okay, what side is the tightest? Sorry, I'm going to have to block the camera so I can actually get a good perspective. There, okay. So yeah, in her case, her right side is a little higher than her left. So what shoe was more worn?
The right one.
The right shoe, okay. So yeah, I mean, it just confirms with what shows with the shoes. That doesn't always happen, but most of the time it will. So that's how you find it. So step 1, find the top of the iliac crest. Step 2, find the PSIS. Step 3, find out which side is higher than the other. Is it higher on the right, higher on the left? In Donna's case, it's a little bit higher on the right side. All right. So your patients, not only do they like the palpation, but they like to know what's going on in their body. So when you add this piece in your examination, you always let them know we have to get your body back to center. So think about centering the body. Primary bias is first. If someone does have leg length discrepancy, then you have to take that into consideration. But most of the time, I would ask your patients the specific question, have you actually had it measured out? Is it really, is your one femur longer than the other? Or do you just have some imbalances in the hips? And usually it's just in the hips. Okay, so questions on that? Everyone clear on what the primary bias is? Because this is the whole foundation for structural alignment. Remember, there's a very simple way. There's 4 pieces of diagnosis that you need to learn. This is step 1, primary bias. Primary bias has 3 steps. Lower, higher, higher on the left, higher on the right. Primary weight bias. Okay. Second step is called the secondary. Okay, so secondary. Since you guys I'll try to draw the scapulas. Okay, so this is probably not super detailed for those artists out there, but it should be enough. So this line here, this is going to represent T7 to T8. And this comes down, I just draw the whole spine. Okay, so this is the line you're going to look at for the secondary bias. You're going to look at, here's arms, kind of an alien creature, but let me draw a line here. We'll see which one is. So in this case, you're looking at which scapula is the highest. So is it the right side or the left side? In this case, well, that line's not very easy for you guys to see, but it's the right side. I'm going to make it a little more dramatic. So yeah, so this would be whatever side is the highest, so that becomes a right secondary. Okay, so in the secondaries, let's talk about okay, so in the right secondary, what's going to happen if this shoulder is pulled up and they've got more tension on this side? So this person, excuse me, the side that's the highest is your primary bias. The side that's the lowest is your secondary bias. So this person, once again, is a left secondary. I think I said right secondary before. My brain doesn't work when I'm drawing and talking at the same time. So this is the left secondary. So what organs are going to be affected with this person? So this person is going to be walking like this. The right shoulder will be higher than the left. Heart, right? We talked about the heart. What else is on your left side? Pancreas. What else? This is going to start to affect digestion. I mean, there's so many things, but the biggest thing is heart, pancreas. So it's going to affect blood sugar. It's also going to cause more likelihood for the person to have heart disease. Okay, the right secondary. Let's say that this is shifted. So now the right's lower than the left. So it looks like that. So with the right secondary, this is liver, right? We talked about liver. That can also affect your stomach and spleen. And then what position would affect your lungs and your kidneys? Lungs and kidneys is almost everybody who's got no kyphotic curve in their neck. So lungs are going to be a position that's more like this. You still want to look at their primary and their secondary, but their shoulders are going to be rolled forward. Their chest is going to be really tight. The kidney pain will be when it's rolled up too much. When you've got the small of your back you've got a little bit of hyperkyphosis. That's where it's going to really affect your kidneys. Okay, so primary, secondary. So these are your two pieces of diagnostics. So Donna, do you mind standing up here again? We'll find your secondary. Yeah, it may help. Okay. So you want to palpate down, feel the vertebrae, and then look under here, find the lower border of the scapula. And then, you know, most of the time, you can do this with clothes on. It's a little easier with clothes off, but okay, so then you just take a line. So Donna's right is just a little bit lower than her left. I don't know if you can see that. So Donna is a right-right pattern. So So if we were to exaggerate it, she's going to be like this hip will be higher, this shoulder's lower. Okay.